Okay, good morning, everybody. Good morning, good morning. And welcome to this Just Cancer UK Patient and Carer Conference. I will be your host for today. I'm standing in for Nick Puntis, the chairman. He's actually at his daughter's wedding. So we thought that was a reasonable excuse not to be here. But I think it also shows that life goes on with Gist. Nick is a patient. I'm also a patient, and you will find many patients around here today, and obviously the people that support them, who, quite frankly, sometimes I think get forgotten about by the health service and everybody else. And we'll be talking about that a little bit more later on. So as I said, my name is Tony Manuel. I'll introduce the agenda for today. So this is today's program. I'm afraid you're going to have to put up with me for about 15 minutes because we're actually at quite an important point in Just Cancer UK's lifetime. We're looking to upgrade or update our strategy for the next 3 years. So I'll talk a little bit about what are our priorities, what we've done to date, how we operate, but also what we think is important for the future. For Just Cancer UK and obviously for Gist patients and their carers. We have a few honoured guests in the room today. So we have some people from Cogent, obviously one of the important pharmaceutical companies. If you want to wave, I saw somebody waving at the back there. There you are. We obviously have our speakers, Andrea, and also Ramesh, although Ramesh seems to be missing, as usual, in action at the moment. I'm not sure where he is. En route. Okay, good, because he's speaking after me. And we also have Dr. Sorrel Bickley from Sarcoma UK, who I think is the first time at a Just Cancer conference. So welcome. Okay, so I'm going to talk, as I say, for about 15 minutes. And then Ramesh is going to talk about some interesting research and findings they've done. And we've talked about this topic a couple of times before in these conferences around generic imatinib. Obviously, there are a number of different versions of imatinib these days. Some of them have different side effects to what was the original, which I think was Gleevec. And some of them, they're not actually sure are working as well as they should be. So I think Ramesh is going to talk about the findings from that particular project and also what's going to happen next. And then Andrea will talk about some of the ongoing and recently completed clinical trials around Gist cancer. And then in the afternoon, once we've all had a nice lunch, then Ramesh will talk about post-Gist patients, so wild type, particularly what's going on with the clinics, and again, some updates on research, etc. And then we'll have a video about fundraising. Our existence is not to raise funds. Our existence is, we do need funds, but we need funds to support Gist patients and also to fund research that we think is important for our community. And then we'll do a round table. So one of the things that I think I've certainly found is the most useful of these sort of patient carer conferences is actually talking to other patients and carers and sharing experiences. So I don't want to see anybody sitting silent when we come to this section. Obviously sit silent while other people are talking, but during the round table I'd like to see everybody sharing their views and ideas as to how we move forward. And then obviously we also want to get some feedback from you, so there are evaluation forms on your tables at the end of the conference. We'd like you to give us your feedback, what worked, what didn't work, what you'd like to see in the future, etc. Okay? A couple of housekeeping things first. So there are no fire alarms today, so if the fire alarm goes off, then it's a real fire alarm, not a pretend one. And where you basically will go in case of a fire, you'll obviously go down the stairs, out the main entrance that you probably came in, and turn left. And that's where the fire assembly point is. Okay, toilets are just outside the door. and hopefully we'll have plenty of time for coffee, talking to each other, etc. Okay. So, next. Okay. What are our priorities? So, it's maybe a bit of an eye chart for you people at the back. I'm sorry about that. But that's your fault for sitting at the back. So you should have been at the front. So at the present, what we do is we are the only charity in this country that focuses exclusively on GIST cancer. Okay, whether that be GIST or that be wild type, we are focusing on GIST cancer for the benefits of patients, also their carers, and obviously clinicians. We work a lot with clinicians, we work a lot with researchers, and we're trying to make sure that there is a focus on GIST cancer. We're run by volunteers, so everybody who is supporting the charity is a volunteer, including all the trustees, and we have various different jobs. My day job is IT, so I deal with all of the IT systems, etc., when I'm not standing in for Nick. Where are we going? Well, we're not saying the strategy is going to change, because these are important things that we need to focus on. So we'd love to find a cure for this disease. I'll be honest, the chances of us finding a cure for every single GIST cancer and every variant there is pretty slim. But nevertheless, we've come a long way in the past 20 years. We now have at least 3 drugs, possibly 4 drugs, that will work if one of the other drugs stopped working. So you have first line, second line, third line, fourth line. If you have KIT mutations or PDGF or A. If you're a wild type at the moment, it's unlikely the drugs will work, but nevertheless, you still have surgery, etc. And we are looking very actively to see how we can support wild type patients. Obviously, we raise funds to pay for this research, to pay for the charity itself, and I think we do, you can tell me if I'm wrong, but I think we do a reasonably good job of supporting patients. So we have our listserv, we have the helpline, and obviously we organise conferences like this. There's two in England every year and 1 in Scotland. Okay? And what is very important is actually raising awareness of GIST. It is a rare disease. There are, I think, around about 900 new patients in the UK every year of GIST. Of those, less than 10% are wild-type GIST. But a lot of GPs will never have heard of GIST. So if you go and talk to your GP, it's highly unlikely that they know what you're talking about when you've been found by hospitals. There are specialist sarcoma centres. We have a list of them. And a high recommendation would be to anybody who's diagnosed with a GIST is get treated at a sarcoma specialist centre. And they should refer you. So support, as I said, we do the telephone helpline, we do email, we do face-to-face. Research, we have the GIST tissue bank that's been set up with, obviously with a lot of support from Jane Bressington. So we now have GIST tissue samples that we are trying to grow in little Petri dishes to see how they react, how they mutate, how they change, etc. And obviously have them available for researchers. We provide grants for specific research into GIST cancer, and we monitor those projects. And a very important initiative, which I've certainly been on, and I know other post-GIST patients have been on, is the clinic that Dr. Ramesh Balusu runs in Cambridge, which basically is a, if you like, second opinion referral and will support you with your needs as a post-GIST patient. And that runs in Cambridge twice a year, Jane? 3 times a year. 3 times a year, thank you. Information and awareness is an area where we think we probably need to focus on a bit more. So we have an educational video that was put together specifically for GPs. But obviously we need to figure out how to get that into the hands of GPs and actually get them to watch it and learn from it. We maintain our websites, and we have a wide range of literature which you'll find at the back of the room there if you want to take a look on a number of different topics. And that's what we do today. So, where do we want to go in the future? I mean, obviously those all remain a priority, that's a given. An area that we don't think there's a lot of support necessarily today for GIST patients and the people that support them is around mental health. So an area that we talked about yesterday in our trustees meeting was how do we actually help patients with the mental side of being a GIST or being diagnosed with GIST. At least in my view, there was a lot of focus on me as a patient. So, you know, I was talking to people like Professor Bas Hassan, who's a clinical oncologist. I was talking to the surgeons, etc. But for the people around me, like my wife Helen or my children, there actually wasn't a great deal of support. So we think that an area that we should be championing in the future is around mental health for everybody who's affected, either directly or indirectly, by GIST. We do quite a lot of lobbying today. So Jane Bressington and Nick are quite active in talking to UK and EU policymakers, trying to improve the outcomes for GIST patients. So we work with a number of acronyms, because everybody loves an acronym. Hang on. I'll just tell you some of the ones we work with. So we work with NICE, the National Institute for Health and Care Excellence. They're the ones who basically decide whether or not the NHS is going to fund a particular drug. And there is some discussion going on right now about one of the drugs. Is it regorafenib or ripretinib, where it seems to be too costly for the NHS at the moment. So that's under discussion. We talk to the MHRA, who's the Medicines and Health Regulatory Agency, NICR, the NHS, Scottish Medicines Consortium. So these are groups that we interact with and try and lobby on behalf of GIST cancer patients. We're very interested in working with some other charity groups. I mean, there are obviously much bigger charities than GIST Cancer UK out there. Cancer Research UK is probably the preeminent, prominent cancer charity in the UK, and a lot of the research funding comes from Cancer Research UK to, you know, various clinicians and researchers, and also obviously also Sarcoma UK, which specialises in soft tissue sarcomas, of which GIST is one of the sarcomas. So we're very interested in working more closely with those charities, basically to help strengthen the voice and the messages around GIST in the UK, and not just in the UK, but internationally. So we do work with other charities like Life Raft Group in the US, and there is some moves now to try and get an international trial together with the US and some other countries, because we think that's the best way to get the number of patients that you need to run a clinical trial, particularly for wild type. I mean, wild type, there's less than 10% of all GISTs are wild type. But if you look across the US and the UK and Europe, then you've probably got a good sample of all the different wild types that you can have to run clinical trials. If it was just in the UK alone, you might struggle to get enough patients to make the clinical trial valid. And we obviously also attend and contribute to national and international events. There are events that we've already been to this year, like British Sarcoma Group, ESMO, which was the one you went to in Switzerland, Jane? It was the Sarcoma Rare Cancers Conference. And there's some coming up in Ireland later on in the year that we will also be attending. They are good places to go and talk to clinicians and researchers and professionals in the industry. And obviously we want to improve access to research and clinical trials for GIST patients. So Jane and I are participating in a European Union, it's called EUXCT, yet another acronym. So it's the European Union Cross-Border Clinical Trial Initiative. So this is an initiative that's trying to make it easier for patients from one country, at the moment it's limited to Europe, that includes the UK for this purpose, to try and get remove the barriers between people moving from one country to another to participate in a clinical trial. Now, you'd be surprised just how many barriers there are to doing that, mostly evolved around money or costs and insurance. But this initiative we think is very important because, again, it will allow you to have a bigger pool of patients and be able to actually take advantage of a trial that's being run in another country. Obviously, promotional campaigns, and we're also interested in jointly funding research programs with other charities like Sarcoma UK. We tried to do this last year. It didn't get off the ground, but there's every chance that we'll do it again this year. Okay, so that being said, that's some of the ideas we've had. One of the things that we've also talked about as a charity is that we actually would like to increase your participation in what we do. So we do get feedback from you, we get feedback through forms, etc. But actually, and again, I'm going to plagiarize what Sarcoma UK have done because I think it's quite clever. They actually actively ask their patients, their community, to get involved in what they do. So whether it's sharing your story and putting that onto social media and websites, whether that's working with them as a lay person who will actually go and look at the research projects that are coming up and say whether or not it makes sense as a lay person, what are the benefits, what are the outcomes. And we obviously have a medical advisory board which looks at it from a medical research point of view, but we'd also like to get more patients involved in saying, okay, what does it do for us as a patient? Okay, so that's on the research side. And we're always looking for more volunteers to help us. Okay, so we have a lot of administration that goes into making sure that all the materials that you see get to the right place, get to the patients when there's a new patient who registers through our website. They get sent a pack which includes all the booklets, etc. These are things that we need more help to logistically manage. So if anybody's got some spare time, is looking to volunteer, even if it's on a part-time funded basis, we're interested to hear from you. Because again, we want to get you to participate more in what we do. And on that subject, so during the agenda today, at the end, we will do some round table sessions, okay? Now that is a session for you all, obviously, to talk to each other, share experiences, but we'd also like you, based on what you've heard, and I'll put that strategy slide back up at the end, what are some of the things that you think we should be focusing on in the next 3 years as a patient and carer community? Okay, so there's probably other things that we're not doing that you'd like us to do, so we want to know what they are, and even better, if you were willing to help do them. Okay, this is our tagline. You're not alone. There are people in this room who will have been very recently diagnosed, like within the last 2 or 3 months. They may not have even had their surgery yet. There are people here like Judith, who had her surgery back in 2001 and is still alive and kicking and very vocal. So, you're not alone. This whole community is about helping each other. Okay, that's me done. I'd like to hand over to, there is one very important thing. So obviously, there are people who've survived a long time with GIST, we call long-term GISTers, and there are other people who unfortunately have passed away. So somebody who was very important to this charity unfortunately passed away last week or this week? Last week, yeah, late last week, and that was Sheena Kinnock. So some of you might have dealt with Sheena. She was our secretary for a long time and was one of the founding trustees of the charity. And very unfortunately, she passed away last week. So our thoughts and our condolences are obviously with... Yeah, okay, she was quite elderly, thank you, Judith. She wasn't 24. No. Yes. Yes, she was a long-term gister, yes.
She was a fantastic
Yes.
Founding trustee and worked tirelessly all the way through her illness and all those years.
And even when she stepped down as a trustee, she was still volunteering and helping us. So a lot of the welcome packs to the new registrations went out from Sheena. So our thanks to Sheena and our condolences with her family and friends. Okay, now I'm going to pass over to Jane, because Jane needs to ask you something very important. And hopefully you're going to say yes.
Thank you, Tony. I'm just checking those of you at the back can hear me okay. Brilliant. If you can't, just give me a point to the ceiling. That's great. But just a very quick introduction. I'm Jane Means. It's another Jane. And I joined as a trustee because I had a gist back in 2019. I found out through a clipboard on my hospital bed, had no idea what GIST was, went on the website, spoke to Jane. I came to a patient meeting just really to say thank you for supporting me in my time of need. And obviously we're always looking for volunteers, and I volunteered to help with the social media. So I've been doing that nearly 3 years now, and as Tony said, you know, we are sort of very busy people, aren't we? And juggling, and any help would be extremely helpful. I am now juggling 2 jobs, so if you've got a Facebook page or a Twitter and you know how to work it, just a little bit of help would be amazing, especially before Christmas. But obviously our role at GIST Cancer UK is for support and research, but with social media I do try and bring a bit of light-heartedness into it, and a little bit of hope, and also humour as well. So I always love a story, you know, whatever you've done, you might have done your favourite thing you've always wanted to do. I want to know about it. If you're doing any fundraising, please let me know your handle. Any photographs is always great. And what I'm trying to do is just for a bit of fun, with I call them GIST bands, the little wristbands. We've got Pause GIST and GIST Cancer. They're a good idea to wear at a hospital appointment, but also if you're going on holiday, you know, you could have it, you know, with the sea behind you or the Empire State Building, etc., wherever you're going on holiday. Tunbridge Wells for me, probably. But yeah, just sort of send me a photo. It's just really nice just to pop these silly little things on social media. And also, please do follow us on social media. All the links are on the front of the website. We are on Twitter, Facebook, Instagram, LinkedIn, and YouTube, so plenty of coverage. You'll see my head is going to be down for most of today. I'm sorry I'm on my phone. I'm sort of trying to keep up with all the channels with a live feed, but do come and see me. I will be here until about 2:30, and if it's okay, I would love to take quite a lot of photographs today. If anybody doesn't want their photograph taking, either pop your head down if you're skiving from work or let me know. But thank you so much, and yeah, I don't know who's on next. Dr. Blusu, isn't he? So, Tony, back to you. I won't do a sing-song.